Sorry, I was home. My kids interrupted me. Um, so what I was saying is this virus comes in and hijacks the hemoglobin. So it actually hijacks the heme, kicks out the iron, and now we have a red blood cell that doesn't have the ability to carry oxygen anymore. And if we can't carry oxygen, we call that hypoxic. We have no oxygen going around our body, so that's labored breathing. And worse, we don't have oxygen and we kicked out iron. Now, as I frequently say, in our bodies, iron rusts. What I mean by that is it gives off oxidative stress. And when we get oxidative stress in our bodies, that causes tissue to break down at a very accelerated rate. So we have too much iron floating around, which oxidizes and destroys a lot of tissue. So we don't know if this is a new paradigm that we're not familiar with yet, this whole iron kicking out hemoglobin hypoxic situation, or if it's the cytokine storm, which is inflammatory, too much inflammation in the body, an over recruitment of our immune system. In either case, what can be done? Well, the drug hydroxychloroquine has been mentioned across the board, and it seems to work. And one of the things that it does is it opens up a zinc ion channel. So we have zinc outside the cell. Hydroxychloroquine opens up the ability for zinc to get inside the cell, and that prevents our copy machines to replicate this virus, so it can't make more of it. Another thing that may happen, which may happen in malaria, it's not truly understood yet, is the hydroxychloroquine prevents it from hijacking the heme, so we have the ability to carry oxygen. And in either case, it seems to be working somewhat in some people in conjunction with some antibiotic therapy like azithromycin, like a Z-Pak. The other piece, though, that I find interesting is we've recommended people try to reduce their inflammatory cascade. So if you're starting here and you get inflamed, it's going to go way up here. If you're starting way down here and you get inflamed, maybe you only come up to here. So things that will reduce your inflammatory burden are very important. And now if we combine that with what can reduce my oxidative stress, they become potentially very important as well. So our starting point is important. So what are some of the things that may benefit that? Well, we've said all along to support glutathione in the form of either NAC or liposomal glutathione, vitamin A, vitamin D. Of course, vitamin C is a huge antioxidant. So these are things that can be done, which we've already kind of promoted to help prevent you from, when you do get sick, if you do get sick, putting you in a better position to recover better. Which is kind of the model of health anyway. The other piece that I think of probably mistakenly sorely under-promoted is resveratrol. So I'm doing a lot of research on resveratrol, and resveratrol helps greatly, according to the published literature, with some lung infections, certainly inflammation, reduces oxidative stress. We've promoted for a long period of time turmeric and resveratrol, and we have the liquid forms in our office. They're just more absorbable in that form. So the resveratrol is very, very helpful in promoting reduction of inflammation as well as quenching or stopping this oxidative stress process in the body. So I think those are important. You got this ball with spike proteins made of fat, comes in our body, hijacks our copy machines. When it hijacks our copy machines, it steals our fat. So there's some individuality there of what kind of fats we have. Then it goes on. When it does get into the copy machine, it makes too many copies, the cell ruptures, releases its virus. At that point, the immune system says, go get help, go get help, go get help. This can be the cytokine storm. The level of inflammation you start at is going to determine the level of inflammation you get to. If you have too much inflammation, your body can't handle that all at once. The other piece is maybe the virus hijacks our heme and our hemoglobin, kicks out the iron, prevents oxygen from binding to our red blood cells. So essentially we have red blood cells that don't work. And the iron that was kicked out is now rusting or causing oxidative stress. So a couple things we want to do is we want to prevent that from sticking to our red blood cells, of course. But we're having a hypoxic event. We can't get oxygen to our cells and we're oxidizing. So antioxidants would be very, very helpful at that point. So I hope this is helpful. I just want to keep putting little bits of information out. This one is under 5 minutes. I want to keep it that way. So I'll get into some more detail on some of them for those of you that want to kind of go down the path of a little bit more scientific or a little bit deeper. But for now, I want to get general information out to as many people as possible so that if we can do some simple things like a little bit of antioxidant support, specifically in this video, I would support resveratrol. I think that seems to be very, very important, and with very little, if any, downside effect. So thanks and stay safe.